Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, what are the clinical features of fibrolamellar hepatocellular carcinoma? In fibrolamellar hepatocellular carcinoma, right? So this fibrolamellar, okay, this will mainly occurs in a younger patients without any history of cirrhosis, whereas hepatocellular carcinoma is common in older patients with history of cirrhosis, whereas fibrolamellar hepatocellular carcinoma occurs in younger patients without any history of cirrhosis. It does not produce alpha fetoprotein. It does not produce alpha fetoprotein, and it is mainly associated with elevated neurotensin levels or increased vitamin B12 levels. It is associated with elevated neurotensin and elevated vitamin B12 globulin level, binding globulin levels. Then treatment. If you see the treatment of fibrolamellar hepatocellular carcinoma, so it has a better prognosis than hepatocellular carcinoma. Why? Because it has a better resectability. It is better resectable or higher resectable rate than hepatocellular carcinoma. It lacks chronic liver disease. There is no chronic liver disease, and it has a indolent course, and thus it has actually a better prognosis than hepatocellular carcinoma. Then here, because it has a better prognosis, obviously you will see that there is long term survival is seen in almost 50 to 70% of the cases. Fine, then what is the treatment of choice in fibrolamellar hepatocellular carcinoma? Treatment of choice is complete resection is the treatment of choice for fibrolamellar hepatocellular carcinoma. In fibrolamellar hepatocellular carcinoma, recurrence is also common, and it is seen in almost 80% of the cases. Lymph node metastasis is also seen, and this lymph node metastasis, which is present in fibrolamellar hepatocellular carcinoma, this will predict the worst prognosis in the patient. Actually, it is a disease of best prognosis, except that if the lymph node metastasis is seen, then it indicates worst prognosis.
thank you and thank you for watching.